today to see the collective effort by the national and county leadership, strategic stakeholders, healthcare providers, and our caregivers in commemorating World Prematurity Day. About 2 weeks ago, I had the privilege of joining Homa Bay County MPDSR virtual session chaired by the Chief Officer of Health. Her Excellency, the Governor, was actually part of that call. Her support and rally to action in ending preventable mortality was really inspirational. And I want to assure the people of Homa Bay County, you have a powerful governor. She has your back in her heart. And thinking about preventable mortalities, especially in newborns, prematurity is the top killer of our newborns, contributing to about 37% of neonatal deaths nationally. So that kind of leadership, that kind of commitment is what we need. Allow me also to say that as CHAI, today we appreciate the efforts shown by our specialists, our neonatologists, pediatricians in the house. Please wave. It has been an honor working with you and through the leadership of the Ministry of Health to be able to develop the essential newborn care training package and the comprehensive newborn care training packages, which will be launched today to be able to scale up quality of care. When we were at the hospital, we realized that quality of care goes hand in hand in ensuring that our preterms survive and thrive. So today, it's an honor for us to be part of that aspect. So we remain committed to support the government of Kenya, both at national and county level, at policy level, ensuring we have the right policies in place, also ensuring that we capacity build our healthcare workers. And this is our commitment to the county of Homa Bay and to all 47 counties, that we shall not just launch the packages, but we will scale up the training of healthcare workers in these packages. The additional commitment we are making, even as we appreciate the opportunity to scale up access to CPAP machine, Dr. Bashir, we will make sure that we support every CPAP donated with a pulse oximeter. And the reason we are doing that is because it's very important for us to ensure that we are monitoring the levels of oxygen saturations even as we continue to administer oxygen and enabling our healthcare workers to be able to do what they need to do. So we remain committed to walking the journey with all of you. And allow me to just finish up by saying that it's really great that today here we have the ability to walk the walk with our caregivers, the wazazi, who have been very instrumental in ensuring our preterm survive. Our healthcare providers, you are the backbone of this effort. Your dedication, resilience, and compassion inspires all of us to do more. To our partners, thank you so much for your support in creating an enabling environment for collaboration. To our government at national and county level, many thanks to supporting us and ensuring that we give a voice to the voiceless. Thank you so much for your leadership, commitment, and investment. I appreciate this opportunity.
Thank you, Betty. Allow us to skip the other partners that we wanted to call. I will call upon the DCC for Homa Bay to just give the greetings from his county commissioner and say a few words. 2 minutes, sir.
Good afternoon, ladies and gentlemen. Mheshimiwa Waziri, first and foremost, I wish to convey apologies from our county commissioner, who is attending another function in Rachonyo East with the CS Education. Our chief guest, Cabinet Secretary for Health, Honorable Dr. Debra Mulongo, the Honorable Governor, Gladys Wanga, the Director General, Dr. Patrick Amoth, our child health partners, our CEC governance, distinguished guests, ladies and gentlemen. The World Prematurity Day is a moment to reflect on the challenges of premature birth, celebrate the resilience of families and health workers, and renew our commitment to ensuring every child has a healthy start in life. Some of the interventions done by the government to eradicate the problem of premature birth in Homa Bay County include the ongoing Social Health Authority sensitization and registration. Through the SHA registration and sensitization, we have ensured that universal health coverage in the county will help to eradicate premature births. So far, the county has registered 753,939 people across all the 11 sub-counties. On the triple threat, the government is committed to end HIV and AIDS as a public health threat and teenage pregnancies by the year 2030, and to end gender-based violence, including sexual violence, by the year 2026. The Ministry of Interior and National Administration has entrenched the triple threat agenda in the routine duties of national government officers to streamline and effectively address the triple threat in our county. On the crackdown on illicit brews and substance abuse, the government bears great responsibility to combat and eradicate illicit brews and drug abuse menace in our county. This obligation extends beyond law enforcement and encompasses comprehensive strategies that prioritize prevention, rehabilitation, and education. The national government commits itself to the following in relation to tackling the challenges of premature births. Number one, raising awareness. We, the GAO and HODs, dedicate ourselves to educate our communities on the causes of premature births and how to prevent them through our normal barazas, through our churches, and through other social events. We wish to also strengthen collaboration by working hand in hand to improve healthcare facilities, train more specialists, and support research on maternal and child health. We also commit to support the families by raising premature babies' needs, not just financial assistance, but also through emotional and social support. We wish to dedicate ourselves to create an environment of care and understanding. Those were remarks from our county commissioner during the Prematurity Day today here at Homa Bay at the KMTC College. Thank you.
Thank you, DCC. Allow me now to call upon our Director General, Dr. Patrick Amoth, to give his remarks and to take over the program from now henceforth. Thank you.
Our chief guest for today, the Cabinet Secretary for Health, Dr. Debra Mulongo, Your Excellency, Governor, County number 43, Homa Bay County, Gladys Wanga, senior officials from the Ministry of Health, development partners present, Mike Gosney, the Mission Director for USAID, County Health Team members, our frontline soldiers, the CHPs, ladies and gentlemen, good afternoon. Before I make a few remarks, I will take this opportunity to invite the USAID Mission Director, Mr. Mike Gosney, to be able to speak to us before I come back. Mike, please.
Homa Bay, Amoso. All right. It's really a pleasure to be here because first off, I'm here with some true friends in development, including the Cabinet Secretary, Honorable Debra Barasa, your Governor, the Governor of Homa Bay County, Gladys Wanga, the CEC of Governance, Grace Mercy Osewe, the Deputy County Commissioner, Director General, who you just heard from, Dr. Patrick Amoth, the Head of Directorate of Family Health, Dr. Isaac Bashir, and the Head of the Division of Reproductive, Maternal, and Newborn Child and Adolescent Health, Dr. Edward Shiren. Good afternoon to you all. As was mentioned, I'm David Gosney. I'm the Director for USAID here in Kenya. I've been here about 2 years. And you may or may not know, but USAID Kenya, our mission here, is one of the largest USAID missions in the entire world. And I think that underscores how important and how deep the partnership is between the American people and the Kenyan people. Because that's what USAID is. We're part of the US government, but we're the part of the US government that focuses on one thing. And that's the partnership between the American people and the Kenyan people. Because we have a shared value. And here, one of the most important shared values that we're here to celebrate is the belief that every individual, every single one in the world, including here in Kenya and Homa Bay, has the right to have a healthy, happy, prosperous family. And that starts with birth and early childhood. And we've been a partner on that for many years. So for 21 years, for the last 21 years, we've been able to invest in partnership some 39 billion Kenyan shillings just in child and maternal health alone. So 21 years. So I think some people over there, that might have been about when you were born. But it's not about the money, it's about the impact. And the impact that we've seen here in Kenya is remarkable. Over half, a reduction of over 50% of child and maternal health here in Kenya. So some of the people I pointed to over here may be alive today because of that partnership, because of those efforts. And that's something to celebrate. I was just at the hospital just next door, and there I saw some of the efforts that contribute to that. The bed warmers that exist where preborn children get the warmth and care that they need, which is so important. And that has helped bring down infant mortalities. Nutrition, so important in early stage development. Again, malnutrition rates over that time period have been cut in half. Again, a remarkable achievement in Kenya. But there's an issue. There's a major issue facing and a major challenge, and that's what we're here to highlight today, is that prenatal deaths have remained stubbornly high. Just today, again, at the hospital, we saw that just recently 14 deaths have occurred on newborn children. And one of the main reasons for that is lack of medical CPAP machines and oxygen for those preborn babies early on. And one of the reasons for that is those machines are expensive. If you bring one from the United States, it costs some 1.5 million Kenyan shillings. And this is where a story comes in. I said I've been here for about 2.5 years. Well, about 1.5 years ago, I was down along the coast near Mombasa and Kilifi, and I stopped into a Kenyan medical supplier. And they said, hey, we have this new technology developed overseas in America, but we can produce it here. And we can produce that for 74,000 Kenyan shillings, and it's a CPAP machine. And so we went back to the team and said, hey, we have to do something big. We know this is the leading cause of prenatal death here in Kenya. We have the opportunity not just to help a few hospitals, but to help hospitals across every county in Kenya to make sure that that is no longer the leading cause of prenatal death in Kenya going forward. And we put together a package, and that's what we're here to celebrate today. Some 1,080 CPAP machines, some of them are sitting right over there, that will be going to hospitals around Kenya, including here in Homa Bay, 15 to the hospital just close by, and 6 others to 2 hospitals nearby, that we are assured are going to be part of addressing that critical challenge going forward. But that didn't occur alone. That occurred because of partnership and leadership. And that's why I want to express my deep appreciation once again to the Minister of Health for their deep partnership today and in the future, I'm sure. To Gladys Wanga, your governor, deep partnership not only in this, on so many other areas, who's leading the way here in Homa Bay. And I also want to recognize the community health workers, because that's another shared value. In America, we also call you frontline workers. We also call you heroes. You have the respect of everybody, including the frontline workers back in America. They're here with you today. Thank you for your service. And lastly, I just want to recognize the frontline workers here in USAID, Cornelia Ochala and Eric Manlagara. Could you please just wave? Yeah. Thank you, because they're the ones, they were there on the front lines, making all today happy. Thank you so much for sharing today. Asanteni sana.
Thank you, David, sorry I got your name wrong. I also want to take this opportunity to join hands together with you as we celebrate the World Prematurity Day, a global event marked to be able to celebrate the resilience of our premature babies. We want to start by thanking the County of Homa Bay for hosting us together and for the great leadership shown by the governance structure in Homa Bay County. Progress that you have made is indeed remarkable. As a country, we have made significant progress in terms of improving the lives of women and children in this country. Our children, more children live to be able to celebrate their 5th birthday. More children are living to be able to celebrate their first birthday. But we have a challenge when it comes to neonatal mortality. Our neonatal mortality rate has stagnated for the past 15-20 years at a rate of 21 neonatal deaths per 1,000 live births. The global target for 2030 is 12. So we really need to put our best foot forward to be able to ensure that we reach that global target. If we can be able to address the burden of neonatal mortality, we will be able to address infant mortality and also under 5 mortality significantly. Homa Bay as a county, your neonatal mortality rate stands at 26 deaths per 1,000 live births. That is way above the national average of 21 per 1,000 live births. Your infant mortality rate stands at 41 per 1,000 live births, again above the national average of 32 per 1,000 live births. But I want to applaud you because you have made significant progress in addressing malnutrition, an underlying factor for most of child mortality. Your rate stands better than the national average. More mothers in Homa Bay County deliver in health facilities at nearly about 89%. The national average is about 90%. So nearly 9 out of 10 mothers deliver in a facility. And if 9 out of 10 mothers deliver in a facility, then our babies should not be able to die, because these are people who are delivering under skilled care. We need to be able to improve the capacity of the healthcare workers, to be able to improve on the quality of services that they provide, so that our premature babies can not only survive but also thrive. I want to congratulate you again on the progress you have made in terms of fighting the burden of malaria. Again, one of the leading factors for child mortality. Homa Bay as a county actually now leads in the war against malaria in terms of the trends and the milestones that you have made. With that in mind, we also introduced the malaria vaccine, the RTSS. However, we had a challenge in terms of the dosing schedule for that vaccine. We have received technical advice from Kenya National Immunization Technical Advisory Group to change to a more easily administered vaccine, the R21, and therefore we hope that we'll be able to reach more children. We have this burden of teenage pregnancy. Teenage mothers are likely to give birth to premature babies. Our teenage pregnancy rate as a country stands at 18%. For Homa Bay, that figure is slightly higher, it's 24%. So nearly a quarter of the births in this county are because of teenage mothers. Teenage mothers face challenges. They may not be able to attend antenatal clinic. They may not be able to be fully grown to be able to persevere through the process of labor. They may not be able to receive adequate nutrition, and therefore that puts them at a risk of not only dying during childbirth, but also their children dying in the process. Therefore, we want to work together with the Ngao team to ensure that our girls, the best place for our teenagers is school, not the maternity wards. And the county commissioner, through the representative team, the DCC, we really need to work with the justice system to ensure that these people who put our teenagers into early motherhood then are brought to book. I want to assure Homa Bay County of the full support of the national government. We will continue to be able to develop the human capital in terms of the healthcare workers, establish more neonatal intensive care units or the NICUs. We are also going to develop guidelines, for example, in the use of latest technologies, including the use of caffeine citrate. And of course, we cannot be able to do this alone, and that is why partnership is critical. The partnership that brings together all actors so that we can be able to have this discussion to be able to make a difference. That way, then we can be able to ensure that our premature babies not only survive, but thrive to be able to achieve their full potential. If for any one reason that I want to come back, it's because of the music, because it's about life, balancing work and life. And therefore, Waziri, I would plead with you that at the earliest opportunity we also get to come back to Homa Bay to dance again. Allow me just 1 minute now to talk to our people in French, because these are highly educated people. Joturwa, amos unokwe uru. Sanido ng'ek mwantie, ichenro mar sirikal. Koro wadwan duto mondo wabed mbele mondo wandikre program masha nikech SHA unlike NHIF kondiki kata sani kidonjo hospital kanyo dinwang'o thieth kanyo maonge chudo mora mora. Kindikori e SHA kidhi e level 2 level 3 facility onge chudo midwaro. Chudo en from level 4 level 5 level 6 to ka wawuothi hospital kawuono ng'enji maber ne chudo en na between $500. To jogo duto ma onge gi nyalo sirikal biro chudo ni. Koro kaka
Thank you very much, Dr. Moth. Our chief guest, our DG for Health, Dr. Moth. And Dr. Moth, I want to really congratulate you because the times you have been here, you are acting DG, and you're acting for a very long time. So, as your people, you know, because you know we are your people. As your people, allow me to really thank His Excellency the President, Dr. William Ruto, for finally confirming you to the position of DG. Because you know that Terry acted for a very long time. And every time we were always trying to get him confirmed, and finally he is confirmed. So as his people, we really are thankful. Our USID Mission Director for Kenya and East Africa, our friend David Gosney, you've been here with us all the time. There is no time you haven't been here when we are having functions here. You have visited us, but you've also supported us. USID is a friend of Homa Bay. And the US government, we know you are a friend of Kenya, but we feel that you are very, very friendly to us as the people of Homa Bay. So we are very grateful to you, and we are also very sad that our friend, Ambassador Meg Whitman is leaving, but please take to her our very best wishes because she has been a great friend of Homa Bay. Staff of Homa Bay County, the CEC for governance, our chief officers, our directors, various staff here, our pediatricians who do the job, you know, on this matter. Really, thank you very much. Our NBU staff, our matron at the hospital, Dr. Duor and your entire team, KMTC, our principal and our students of KMTC. Asanteni sana for hosting us. Our CHPs, we value you, we love you. I love you, I value you for the great job that you're doing in our communities. Really, the data that is being spoken to here cannot be possible without you and the work that you are doing. Okoro mana go nuero kamano gi English. Okuwinjo wechego. Enero kamano maduong. Thank you very much. Our mothers who came to give their testimonies of our children surviving, we are really, really proud of you and what you've spoken to us here about. So we come together today to commemorate the World Prematurity Day, a day of reflection, learning, and action for the sake of our most vulnerable, our preterm babies. This year's theme is Born Too Soon, Right Care, Right Time, Right Place. Reminds us of the critical need to provide quality health care for premature babies and their families. Globally, approximately 15 million babies are born preterm every year. This means 1 in every 10 births. Sadly, complications related to prematurity remain the leading cause of death in children under the age of 5, claiming nearly 1 million lives annually. Here in Kenya, the situation mirrors the global trends. According to MOH, about 134,000 babies are born prematurely every year, with 10,000 of them not surviving due to inadequate care and complications. And our minister is here. She'll probably speak more about the numbers at the national stage. In Homa Bay County, prematurity is a significant challenge, with neonatal mortality rates, as Dr. Amoth has said, at 26 per 1,000 live births compared to the national aggregate of just 21, which is unacceptably high. Our healthcare facilities are overwhelmed, and parents struggle with limited access to essential preterm care services such as neonatal intensive care units and skilled healthcare providers. These challenges often mean the difference between life and death for our preterm babies. Amidst the grim situation, we have tried and achieved encouraging, remarkable progress. I'm proud to report that in Homa Bay County, we have increased access to maternal and newborn health care by strengthening our primary health care systems. Kangaroo mother care services are now available in several of our health facilities, offering cost-effective and impactful care for premature babies. We are collaborating with national and international partners to improve access to neonatal equipment, such as incubators and oxygen therapy machines, as well as training healthcare workers in specialized neonatal care. This event is a testament to the power of partnerships, and we really want to thank USAID and David for the announcement of even more equipment for our healthcare facilities. To this end, may I specifically or specially recognize the contributions of organizations such as USAID, and you heard what David has said, the Clinton Health Access Initiative, CHAI, who I think are also represented here, the Neonatal Essential Solutions and Technologies, NEST, M-Pesa Foundation, and the Gertrude's Hospital and Foundation, among others, whose immense support has been instrumental in saving lives of many preterm babies in our county. I've also seen here Martha from Nutrition International, with whom we are beginning a partnership on matters nutrition for our county, and we are looking forward to that partnership. As we commemorate this day, let us remember that addressing prematurity requires collective effort. So one, healthcare providers, let us continue to train and equip our teams with skills and resources they need to handle preterm births effectively. To our community leaders and stakeholders, to advocate for early and regular antenatal care for expectant mothers and address cultural practices that hinder maternal health. And we saw the skit by the CHPs here, giving the cultural context that sometimes hinders maternal health for preterm babies. For parents and caregivers, we seek early care and ensure babies born prematurely receive the right care at the right time. For our development partners, continue to invest in Homa Bay County's healthcare system so that no child is left behind. My government remains committed to improving maternal and child healthcare. This can be attested to by the fact that in our current CIDP, we have prioritized upon availability of resources, the building and equipping of at least 2 specialized neonatal units by 2026, training an additional 26 healthcare workers in neonatal care, rollout of community health initiatives to raise awareness about prematurity and maternal health. Together, we can ensure that every child born prematurely in Homa Bay County has an opportunity not just to survive, but to thrive. In closing, I want to thank each and every one of you for being here today, and really to the National Ministry of Health for choosing Homa Bay for this very significant celebration. To our healthcare workers, your tireless efforts do not go unnoticed. We notice and we appreciate the work that you do on a day-to-day basis. To the parents of preterm babies, your strength and love inspires to do better every day. And to our partners and supporters, thank you for standing with us. Let us continue working together to ensure that prematurity is no longer a death sentence, but a challenge we can overcome. Thank you, and God bless Homa Bay, and God bless Kenya. And as I close, we were asked how many had registered on SHA, but I don't know how many put up their hands. I couldn't see properly from there. Now that I'm up here, maybe I can see. How many have registered? Diadimos are registered. How many people have registered on SHA? Okay, how many haven't registered? Just put up is okay, because it's new thing, isn't it? Some people registered yesterday, some can register today, some can even register tomorrow. Even the following day you can register. Put up your hand if you're yet to register. Allah? So you haven't registered and you've registered at the same time. I'm looking particularly at the students. How many students have registered? How many have not? You see, we are going to bring registration here to the KMTC so that more people can register here. So Suri, let's bring a registration desk here so that the students can have a way to register without, and you don't have to worry about paying for now. Just register. Register, do your thing, just be registered. Some people are still thinking that NHIF is going to come back. There are people who are thinking that no, they are living in denial that NHIF will come back. So I just want to announce to you that NHIF is not coming back. The SHA train has left the station and it's moving and it's going. And SHA is superior to NHIF in many ways. I want to tell you, for example, look at our facilities. Previously, when we delivered, when mothers came to our facilities to deliver, the reimbursement for a normal delivery was 5,000 shillings. Right now, the reimbursement for a normal delivery is 10,000 shillings. In fact, we are working on a plan to have our CHPs. If you bring people to deliver in our public facilities, within that 10,000, we find a way to encourage you with some transport, so for bringing mothers to deliver within the public facilities. Because it has moved from 5 to 10,000. For cesarean section, it moved from 17,000 to 30,000 shillings. For primary healthcare, you know that our lower level facilities right now are struggling. But right now, for level 2 and 3 facilities, for everybody who registers around those facilities or linked to those facilities, there's a capitation that comes from national government of 900 shillings per person. That is capitation, which means that our facilities are therefore able to raise money to be able to provide services. Edu Afia used to be for high school students only. Right now, even students in primary school, even our children in primary schools, can access healthcare under SHA. Right now, with NHIF, if you went even to do a surgery here at the hospital, you can wait even 3 days for approval, pre-authorization to come back. With SHA, it's happening within minutes. And this is what the healthcare workers are saying. Within minutes, you are able to get the pre-authorization to receive the services. I know that for us who are paying 2.75%, we are looking for the super cover that used to exist when we paid NHIF, sindio? Lakini this is social health insurance, where this is social health. Social health means you and me, we combine effort to make sure that everybody else is able to receive something. So that is where you are feeling the pinch kidogo. Because you who had the super cover, and this is going to be improved as we go along. The services within SHA will be improved as we go along. So I think what I want to say is that let our people register for SHA. Let us continue to our CHPs. Ako nuero kamano kum teach muti yo my registration a ground. Meduru register jowa e SHA kai. Ma yo makoro wadigo majo wadiyo dogotie. Ero urukamano nyasayo guedu nyasayo ritu. Thank you so very much. And I want to now take this opportunity to ask us to rise as we welcome our chief guest for today's event, our cabinet secretary for health, Dr. Barasa. Karibu sana daktari.
Thank you so much. Please do have your seats. Thank you. Your Excellency, the Governor of Homa Bay County, Honorable Gladys Wanga, distinguished representatives from the United States Agency for International Development, the United Nations Children Funds, Clinton Health Access Initiatives, Nutrition International, Save the Children, MCGL, Nest 360, PAC, the Kenya Pediatric Association, and other esteemed partners, all honored guests, ladies, gentlemen, parents, children, CHPs, KMTC, colleagues and staff. I'm also Asante sana. Thank you so much for joining us today as we commemorate this year's World Prematurity Day. Your presence reflects a shared commitment to safeguarding the lives of our newborns and ensuring they not only survive but thrive to reach their full potential. Prematurity remains the leading cause of newborn death with far-reaching impacts on families and communities. A World Prematurity Day serves as a critical platform to raise awareness of the challenges posed by preterm birth, foster supportive environments for affected families, and promote innovation in care and strategies to prevent preterm births altogether. Globally, the scale of prematurity is staggering. The 2023 Born Too Soon report by UNICEF and WHO reveals that 1 in 10 babies, an estimated of 13.4 million, are born prematurely each year, and in the sub-Saharan African bears the heaviest burden, with many of these vulnerable lives lost to preventable causes. In Kenya, 12% of all live births, equivalent to 100,000 to 150,000 infants annually, are preterm. Prematurity is also the leading cause of neonatal death in our country. The 2022 Kenya Demographic and Health Survey reports a neonatal mortality rate of 21 per 1,000 live births, nearly unchanged since 2014 and almost doubling. The Sustainable Development Goal targets of 12 per 1,000 by 2030. And so neonatal death, again, accounts for 51% of under 5 mortality in Kenya, yet many of these tragedies are avoidable, though through proven cost-effective interventions. The theme for the World Prematurity Day is access to quality care everywhere, and it underscores the need to bridge the gaps in care that hinder newborn survival. Evidence-based interventions such as the kangaroo mother care, advanced respiratory support, the use of caffeine citrate, among others, have shown to cause significant reduction in risks associated with prematurity and complications. And so providing quality care also means that families in the caregiving process foster better developmental outcome and stronger emotional bonds with the children. And it requires equipping our healthcare facilities with tools, training our health workers to manage preterm and sick newborns, and ensure timely referrals through the integrated care model like the primary care network framework under UHC. So ladies and gentlemen, let me allow me to highlight some of the key measures the Ministry of Health has undertaken in the past decade to strengthen newborn care. First of all, the development of policies and training packages, where the ministry has finalized 2 training packages that integrate all newborn care interventions, the comprehensive newborn care package for level 4 and above, and the essential newborn care package for primary facilities. These will be enrolled out nationwide this year. Equally, the ministry has capacity built healthcare workers with support from partners who have trained the healthcare providers across the country in comprehensive and essential newborn care practices. Equally, we have improved monitoring of newborn care indicators through the admissions by the development of standardized data collection and monitoring in all admitting facilities. For the provision of equipment and supplies with support from development partners, as has been said by our USAID colleague, we have supplied key equipment such as the warmers, incubators, CPAP machines, phototherapy units, among others. And we are particularly grateful to USAID and HUD for these generous donations of bio CPAP machines, which we flag off today for distribution to facilities nationwide. So these interventions have a profound impact not only on premature infants, but also on all small and sick newborns, ensuring their survival and long-term health. And so as we reflect on our progress, we must also acknowledge the road ahead. Achieving the Sustainable Development Goal requires a collective effort to enhance maternal and neonatal health service, particularly at primary health care facilities. We urge counties to prioritize investment in newborn care by improving infrastructure, skilled human resource, and ensure availability of essential medicines, diagnostics, and technology. I want to extend my sincere gratitude to our development partners, the professional associations, academia, county governments, private sector, community health programs, GAO, among others, for their great advancement in towards UHC as well as neonatal agenda. So again, I would just like to give a few highlights about our assessment in Nyanza as well as in Homa Bay County. We really appreciate the great work that is ongoing. I can say indeed health is devolved. And Homa Bay is indeed a champion when it comes to SHA and also UHC rollout. Please, let's clap for ourselves. Thank you so much. First of all, I want to appreciate the CHPs for the great work that they are doing. I have listened, I have seen the highlights, we have seen the tangible data, how you're going around in the households, ensuring that the community is being registered. And so we want to encourage other counties. We leverage on the community health promoters to ensure sufficient SHA registration so that our people can be able to access the services. Equally, we are happy with the maternal, neonatal, and child health in the region. We have been able to visit the maternity center with the newborn unit, and I was happy to see that mothers are actually being registered under SHA. We have seen that it is efficient during the registration process. We have seen mothers paying from 300 shillings and being able to access care. I'm also impressed that for this month, the number of deliveries have actually improved or increased in this region from 200 to around 370, and so we appreciate that. And we have also noticed that the maternal deaths are also markedly reduced. So we encourage you to keep up the good work. The meetings that you are having to address maternal mortality are really critical during this time. We have seen the newborn, and I am very impressed with the testimonies that have come in that children as small as 600 grams are actually surviving in the extreme counties like Homa Bay County. And this speaks to the devolved government and the great work that Her Excellency Gladys Wanga is doing in order to improve health service delivery in the county. And so my plea to the governors, I'm also talking to the G7, the ladies, I'm talking to mothers out there. You know, women, we give back, we take care of children. We are the caregivers whenever our relatives get sick. We know the the importance of health service. And we need to be the front liners when it comes to SHA registration, to ensure that our households are registered, our children, our husbands, our family are registered, and they are able to access these services. Equally to the governors, I would like to just also emphasize what our Governor Gladys Wanga has talked about, that for every registration in your county, that improves the primary health care fund that is going to be given to your to the facility. That is the capitation amount. And so the critical or the important part is that we need to register, because that improves the amount of money, the resources that are given, and that way you can be able to improve the capacity, whether it's the equipment, the human resource, etc., to ensure that your facilities are seamless. Like currently there are challenges with medications. If we are able to register more, then we can be able to access more medications, equipment, among others. So let us utilize that platform. Let us utilize the CHP, as our governor from Homa Bay has done, to ensure that more Kenyans are registering in this platform. Equally, I want to emphasize that by the end of November, we will be paying the first social health insurance funds. And so many facilities will be able to get resources to improve their capacity. Again, emphasizing the critical importance of SHA registration within your facility so that you can be able to access these services. I would also like to talk to partners. We have done a lot when it comes to maternal, neonatal, and child health, and even at this time, during the transition period, we request for your support even as we strengthen capacity for maternal, neonatal, child health and ensure affordable, accessible, quality care. This includes support in the areas of Linda Mama and ensuring capacity in the MMCH, including investigation as well as the services that are provided. And a key highlight is the social health insurance, what our brother Dr. Bashir has talked about. With this, the premature children are also undergoing treatment, which was not there by the NHIF. And so mothers, we need to register. If you're pregnant, please register. At level 2, level 3, and selected level 4, you'll be able to get services, that is antenatal, delivery, and postnatal services. And in higher levels, with small contributions from 300 shillings, you could also get services, including any complications thereafter for a premature baby or any neonate that complicates. And so let us encourage our mothers to register moving forward. So thank you so much, Your Excellency, the Governor, for giving us this platform. We have seen, we are optimistic, we love the optimism in this region, we love the synergy, we love the harmony, the work relation with the CHPs and other members, and we are encouraging you to champion SHA, not only in your county, but all over. Discuss with the political elite, with the governors, to be able to grasp, just as you have grasped, the concept of UHC. It is not only beneficial to the individual, but also for the county in order to improve the capacity. So with those remarks, thank you very much. Asanteni sana, and God bless you.